Hello. Let's get started. I know you guys are eager to get out here. First of all, thank you for coming to this last session. I'm John Louis. I'm from Stout Vocational Rehabilitation Institute at UW-Stout. I'm also the co-PI on the RRTC Evidence-Based Practice on Voc Rehab. So I'm the moderator today. Today, this session is on technical assistance and coordination with the state VR system, the perspectives from state VR and provider organizations. So we have three distinguished panel members here. Let me introduce them to you first. On my immediate left is the CEO from CSAVR, Steve Wooderson, and then Alison Flanagan from Kentucky. She's with the National Council of State Agencies for the Blind. And then on the far left is Dr. Fred Schroeder from National Rehab Association. So he's the executive director. So I'm going to just set the tone and then basically let them go wild, okay? So as you guys have heard so far, there's like 7 TA centers. There's 5 here today, and one talked about the JD VR TAC talked about yesterday, but basically that's 7 TA centers. There's a lot of technical assistance centers training going on, so it's pretty crazy. And then also, the state VR agencies are pretty much up in arms with WIOA, as you all know. And WIOA, the key thing that they have to address is transition, and also at the same time, how to work with employers. Not that it's nothing new with working with employers or transition with the VR agencies, although, as you know, some of the youth programs are pretty much very different from a system standpoint than the VR system, which is eligibility program, right? So that there's a lot of complications there. So therefore, we would like to have these panel experts to talk about some of the issues that the VR system faces, and also the vocational rehab providers faces. So kind of set the tone about that piece. So the purpose of the session is basically, from their viewpoint, the perspective on the need for coordination and collaboration. We already talked about how important collaboration is, but I want to hear from the panel members what they think about that. So let me start with Steve first, since he is the CEO for the CSAVR. I'm sure he has got all kinds of phone calls and also all kinds of headaches in terms of addressing this piece with all the state agency directors. So, Steve?
I guess I have headaches. So that's true in many ways, but lots of good things are happening too. So we're sitting in an academic setting, right? First of all, I've never been in a room where all I can see is nose to the top of your head. That is really kind of bizarre. And I've been sitting on the back row for 2 days, so I can see John Connolly's glasses and hair, and that's about it back there. So anyway, so we're sitting in academia, so maybe you should start off with a pop quiz. Is that okay, John?
Go right ahead.
You got to do it. Okay, so how many of us are committed to the profession of vocational rehabilitation by show of hands, okay? I think we've got nearly 100%. How many of us are committed to the quality of the vocational rehabilitation counselor, right? Okay, so I got 100% going there, so we're all in the same boat. So how many of us want to see the profession thrive and really soar as we go into the next reauthorization? Okay, I know that sounds kind of bizarre to hear, but what we're doing right now, folks, the work that we're all about together is preparing us for our thriving profession as we move towards the next reauthorization. And I say that to kind of set the stage for my comments, because what we're about in the evidence-based practice and in the technical assistance community right now is delivering services to our profession in a way that demonstrates our ability to put individuals with disabilities in competitive integrated employment. Okay? So as John talks about some of the, or set the stage for us in some of the issues that from the state vocational rehabilitation standpoint, all of the work that we're doing really has to lead towards that one objective. Fred and I sat on with a group that made probably close to 200 visits on the Hill in preparation for what we now see as WIOA. And one of the consistent themes that we heard over and over and over again is that the vocational rehabilitation profession has to change, okay? And that change has to result in increased outcomes for people with disabilities. So if all of our efforts towards evidence-based practice, research, and technical assistance doesn't lead towards that ultimate objective, then those of us that are committed to the profession, those of us that are committed to the quality vocational rehabilitation counselor, all of us that are committed to seeing a thriving profession down the road, we may find ourselves rethinking our objectives at the time of the next reauthorization. So I don't say that to be a Debbie Downer, going back to Saturday Night Live, right? But I'm saying it to be realistic, that as we are in the business that we are in, we have to think about short, midterm, and long-term objectives that lead towards those outcomes so that we can truly make a difference in the workforce participation rate of people with disabilities. So I've been in a couple of sessions, and I know a couple of sessions that made comments that I just hope that we make sure that we have the bottom line in mind, that the bottom line is up front in our review of evidence-based practices and how we deliver our technical assistance. And I think that's one of the objectives that our state VR agency members of CSAVR are saying to us. Be sure that our researchers understand that the work has to be practical, has to come back to the field in a way that makes a difference in the work that we do. So I want to say how much I appreciate all of you that have been a part of this conversation the last 2 days, because it does give me faith and reinforces that we are looking at it from that standpoint. But one of our concerns, I think, from a state agency standpoint, and I'm speaking on behalf of all 80 state agencies, is that we want to turn this around, the work that we're doing, in a way that really allows our state agencies to put practice into play that makes a difference now as opposed to later. We have a lot of research objectives that'll take many years to unfold. That's well and good. That's a part of change management. But let's also remember that we have to have some short-term and mid-term objectives that really turn the tide in increasing the number of folks that we put to work. I work with a great group of staff, and for those of you that haven't had a chance to know a little bit about CSAVR, let me just mention that we have staff that are virtually working across the country. Our deputy is Rita Martin. If you've heard of her name, you probably have been involved in some kind of legislative emphasis, because that's really her focus as our deputy. Our Director of Business Relations, Kathy West Evans, many of you are involved in research and practice that involves our business relations work. Kathy's involved in a number of the TACs that were highlighted today and the research that we've talked about over the last couple of weeks. And so I appreciate the work that she's doing in representing the state agencies in those activities. John Conley's in the back of the room. John's our Director of Research and Grants. I think for any of you in the room that have any involvement in the needs assessment or any of the other activities we're about, you know that John's all about trying to find ways to improve upon the quality of the deliverables as they impact our state VR agencies. And so John and I have been here for the last 2 days, and that's been a great opportunity for us to engage and be a part of the wider community as well. And then Teresa Hamrick is our operations coordinator. You've probably gotten information from CSAVR through Teresa, and we're very thankful to have her on board. So that was just my opening, John, and I can pass it on to the others.
Perfect. So the next speaker is Alison Flanagan. She will give us a little bit more her viewpoint from the services for the blind, and also she's also the chair for the employment committee, right, with the NCSAB. So Alison?
Correct. Thank you, John. I'm also the director of a blind agency in Kentucky, so I have that perspective as well, because I'm basically living through WIOA daily. And yesterday and today I've heard some really great things that are happening among the TA centers, and there's just so much happening. I think that's the common theme. Everyone has so much on their plate right now. And The needs assessment that Tim shared briefly with us this morning, that's very interesting to me, and I want to see what more of those results are. However, representing the blind agencies, I also want to push or request or beg, I don't know what you want to call it, but that you pull out those results that are specific to the blind and visually impaired agencies, because we are unique. And I'm going to say I spent 17 years in the general agency, and I've been with the blind agency for 6 years. It is very different. When in Kentucky, they all tease me about jumping the fence. You know, I jumped the fence over to the blind agency. And when I was going in, I was like, well, it's the Rehab Act. It's the same, you know, we're created under the same law. We're here for the same purpose. Wow, is it a different approach? The blind and visually impaired agencies do things with a different approach. And I'm not saying either agency, the generals or the combined, do it wrong. I'm saying that you do it different based on the population that you're working with. And that's what I have learned most working with the blind and visually impaired. Such unique specialized services, a lot of staff with such unique skills that really allow these individuals to be successful in employment. So when you do these surveys to all 80 agencies, those 25 blind and visually impaired agencies really need pulled out and looked at differently. Because more often, you know, when I'm collaborating with individuals, they lump everybody together. And what may work for that general agency may not work for that blind visually impaired agency. So that's something to keep in mind, you know, when you're working with the TA centers, or if you're doing research, that's a huge piece of it too. Because so often we'll get research results that look exciting, but when you actually start applying that to your blind and visually impaired agency, it's not quite working that way. So that's one of the things as a director that I'm constantly looking at, is how is this going to apply to the population I'm working with. You know, the blind visually impaired agencies have a lot of challenges as well. Probably if you were in the session yesterday, you heard me talk about the pre-employment transition services, and that is a huge challenge for the blind and visually impaired agencies, just because traditionally the onset of eye disease occurs later in life. We don't have a large number of individuals who meet that age 14 to whatever your state number is. Mine's 21. So it is a bigger challenge for me to spend a higher number of money on a much smaller population. And that is very common among all the states that have the blind and visually impaired agencies. Although RSA will tell you that that 15% federal allotment is viewed as the state as a whole. So basically they were like, well, your general agency will have to carry you. I don't like to be carried. Matter of fact, I don't think anybody could carry me. But I didn't really appreciate that response, I'll just be honest with you, because as a blind and visually impaired agency, we strive to do well on our own. And while we collaborate and coordinate beautifully with our state general agency, and we do a lot of things together, I still want to stand on my own feet. So we're trying to spend our required 15% so that the general agency doesn't have to carry us. That was the word used. So again, that's a huge challenge for us. Another big challenge with your blind and visually impaired agencies is that dual diagnosis that we're seeing. We are no longer hardly seeing someone with just a blindness or just visual impairment. We're seeing a plethora of other things happening. And it's, you know, resulting in those rehab professionals being trained beyond just the visual impairment or the blindness. And that's been a little bit of a struggle with my agency, because that expertise is on the blindness. And then when you bring someone in who has severe mental illness as a secondary disability, you know, the counselors get that, they freeze. It's like, what do I do? Because they were so focused on the blindness. To me, that has opened up our ability to collaborate with that general agency so much better and do those dual cases, because RSA allows that now, and we're really pushing that in Kentucky, so that's something else to think about. You're focusing on maybe that general agency's, because I know in Kentucky, about 40% of what we're serving has a mental health diagnosis. It's either primary or secondary. But that coordination with the blind visually impaired agency, if they have a visual impairment, we're seeing a lot more success there, and I'd love to see research on that, how that coordination between those two agencies are helping, so you have that specialization from both sides coming in together. I will tell you that rehab counselors are territorial by nature, I guess. So we had to build down some of those barriers between the staff in both agencies. So any of you states that have two, I encourage you to work together and figure out how to break that down and to build that referral system and that counseling together. And you just got to keep telling your counselors, you both get credit, because that seemed to be the biggest issue. I will tell you though, you know, WIOA certainly has filled up all of our plates, and as a director, I have to prioritize what we have the capacity to do, not only within our staff capacity, but also in my fiscal capacities. And most states are having some struggles with fiscal, and my state certainly is one of those. I have all my categories closed but one, so that's a challenge as well when you're only working with the most significant. But my staff, that's the thing. And listening these last few days, I can tell you there's a list of things that I like, I'm gonna go back and I'm gonna talk to staff about this, I'm gonna implement this. And then realistically, my staff are gonna go, who's gonna do this? We don't have time. Who's gonna be in charge of this? A lot of my time as a director is spent on the Title I portion of WIOA. You know, we're all gonna get in the boat together and sing Kumbaya. That's what I feel like I do these days. It's working with that DOL, the adult ed, TANF, all of these partners, making sure that we are collaborating and working together. That's what a bulk of my time is spent on. My love is rehab, and I don't get the time to spend on that right now with WIOA. So I'm gonna have to rely on the TA centers to do that rehab research for me and come back to me and go, this is what's gonna work, and have it beautifully spelled out for me so I can easily pass it on to my leadership and managers and implement that. Because if I have to sit down and kind of interpret what you're telling me is working and how that applies to my state, it's probably not gonna get done. I'm just gonna be realistic with you. So that's kind of my perspective as a state director. Love all the research happening. I love all the opportunities that are coming available, but realistically, I need it simple. I need it easy because we have way too much on our plates right now.
Thank you. Next, we have Dr. Fred Schroeder, representing National Rehab Association, which is a membership organization, and many of their members are state VR counselors and also counselors and practitioners in the public and private area. So we would like to hear from these soldiers, in a sense, and also folks that are on the ground doing all the work. What is their viewpoint about all these TA centers, and what is it that we need to do to be more cooperative and collaborative so that we can assist these ground soldiers to get their work done to reach those outcomes that we're talking about. Fred?
Well, thank you. It's a pleasure to be here with all of you. When Allison made mention of the general agency carrying the blind agency, I don't know why this popped into my mind, but the first time I ever went to South Carolina for a meeting, a lady came up to me and she said, when the meeting ends, I'm going to carry you to the airport. And I thought, she's one tough lady if she's going to carry me all the way to the airport. But anyway, okay, so you all researchers here, you are serious researchers. Now, when I got my PhD, my study was a qualitative study. Don't hold it against me. And at the time, qualitative research was viewed as very mushy. And there was a strong bias in education circles to favor quantitative research. And I'm not here to speak in favor of quantitative or qualitative. I think today we have reached a balance where we understand that some questions, the quantitative methodology is appropriate, and other questions lend themselves to a qualitative investigation, and many require both. And they especially require both if we're going to understand the why behind certain findings that we make. So where I'm going with all of this is to say that, in my mind, one of the key functions of technical assistance is to help break new ground. Now, how do you do that? Well, I think you start in your research by saying our research is not just here to catalog what is, but our research is here to help spark our imaginations and see what can be done. In my own mind, I call this advocacy research. So what do I mean by that? All right, Allison runs an agency for the blind, a very good one, by the way. I told her I might move to Kentucky. The agency was so good, and she said, you know, we can help just about everyone. And then she stopped, so I didn't want to pursue it. But anyway, she runs this agency for the blind. Well, let's take something very basic. We know that blind people who read and write Braille have much higher employment rates than blind people who do not read and write Braille, and we know that the quality of that employment is better. So when we research, we could research and we would find certain things about the blind population and literacy. One of them is that the odds of becoming fully proficient in Braille are very low if you learn Braille as an adult. So that's documentable. That's a what is fact. And once you have that what is fact, you can extrapolate certain recommendations or implications from that. You might say, for example, look, and I'm going to make this number up, but it is pretty low. So let's say 10%, 12% of blind people who try to learn Braille as adults become truly proficient Braille readers, however we define proficient. And we've documented that. And now that we have those data, by the way, I want you all to take note, I did say those data, not this data. So I'm pandering to the researchers here. All right, so we have those data. We know that that's the case. So we can extrapolate from that, or say an implication is, let's not bother. Let's not bother teaching adults Braille, because very, very few will master Braille. Therefore, it's a waste of staff time, it's a waste of resources. That would be one conclusion. But under the concept that I'm calling advocacy research, we can also start with an expectation. In other words, we know there is benefit to knowing Braille and to being able to use it well. So rather than catalog what is, perhaps our research question is, what can we do to increase the rate of mastery of Braille among adult learners? But it presumes that mastery of Braille is a value. And I think one of the things that happens in research is we're afraid of bias, hence the null hypothesis. Do people still use a null hypothesis? It always struck me as ridiculous. A hypothesis that said, there's going to be no difference here. Well, if you think that, what are you doing bothering looking at it? Anyway, I don't know if people still use a null hypothesis. But we're afraid of bias. And yet, in my mind, if bias is built in, the nature of the research questions themselves reflect a worldview. I'll give you a simple example from the 1970s. There was an orientation and mobility study that sought to answer the question, what kind of footwear was best for blind people traveling in snow and ice conditions? Now, is that a legitimate question? Well, you can argue it is, because if it's never been studied, how do you know blind people should use the same kind of shoes in snow and ice as sighted people? But to my way of thinking, the question presumes that blind people are dramatically different. So different that every minute thing has to be studied. And so this study took this poor blind lady out and had her wear boots with rubber soles, and then boots with composite plastic soles, and then ones with slippery leather soles, and they counted the number of body contacts with the ground. how many times she fell down. And guess what they found? That wearing slippery shoes, she fell down more than wearing shoes that are traditionally considered good for snow and ice conditions. Well, I don't say that to belittle the researchers, but what I'm saying is, to me, there's nothing wrong with acknowledging. In fact, to me, it's more intellectually honest to acknowledge up front that our questions reflect a certain viewpoint or bias, if you will. And if we acknowledge that, then we can seek to mitigate its impact on our research. All right, so next piece of all of this. Many years ago, see, originally I wanted to be a school superintendent. And so I read a lot of ed administration literature. And in the early 80s, there was an article about a guy. He was retired military. He took over a private school. They had very, very rigid standards. You could be expelled for poor attendance. You could be expelled. They had mandatory homework, an hour a night. They had a mandatory grade level threshold. And the conclusion of the article was essentially that this is a wonderful model because the kids in that school thrived. Well, maybe it's a wonderful model. But if you have the luxury of throwing out anybody who doesn't thrive, what is left? People who thrive. Parents who are supportive and make sure that that homework is done. Kids who can function well under that level of structure. But what has happened so much in our development of many disciplines is that we look at a circumstance that works well in one context and think if we simply replicate the mechanics, then we will achieve the outcome we want. I was a state director during the time when we had management by objectives. Then we had total quality management. Then we had zero-based budgeting. Well, you know what? All of those strategies worked well for somebody within their own organizational culture. I mean, strategic planning. When I went to the Department of Education, we spent 5 years in OSERS trying to develop a strategic plan. Thank God the president got reelected, or we'd have been out of office before we had our strategic plan. And I can tell you, we had consultants come in who were experts in strategic planning. Our plan was not much of a plan, and it certainly wasn't strategic. Essentially, all it was a catalog of everything that you might potentially want to do for people with disabilities. Well, I love that value. I love the fact that people want to do good things. But the problem is that strategic planning, if you look at it as a structure and you superimpose it into an organization, unless the organization buys in not just to the structure but to the underlying culture, then it's, in my opinion, a waste of time. So, to wrap this up, where do we go in terms of technical assistance? I think that it starts with recognizing that the strategies that work well and that demonstrably work well do in fact emanate from certain intrinsic beliefs. Let me say it more plainly. If we said to Steve, we want to visit the best 3 transition from school to work programs in America, or to Allison, we want to visit the top 3 blindness skills training programs in America. You know what you would find if you went to those programs? You'd find staff who love the work they're doing. And they love the consumers with whom they work. They personally invest. And so I'm not suggesting that structures, that strategies, that procedures can't be valuable, but they cannot be sanitized or disconnected from culture, individual beliefs, and organizational culture that emerges. If you look at the Workforce Innovation and Opportunity Act, there are a number of sub-themes, but what is the greatest theme permeating the changes in WIOA? Well, the greatest theme, in my opinion, is integrated, competitive employment as a value. And so we have all this pre-employment transition services. That's not disconnected from that overarching goal of integrated competitive employment. In other words, Mr. Harkin was unhappy that so many youth with disabilities moved directly from special education into segregated facilities. So this overarching goal of integrated competitive employment translated into very specific requirements around pre-employment transition services. And you also see this with Section 511. So we have this challenge now, not that transition's new, and not that working with people with very significant disabilities is new, but the challenge is intensified to really not just say to a person, we don't value sheltered work, so you either attain integrated work or you go home and sit on your couch, but that we say, look, we know that there are people in segregated facilities that could attain integrated competitive employment. How many? 80%? 60%? 40%? 20%? I don't know. But the challenge is not just to catalog what that number would be, but to say, we need to research how best to facilitate the integration of as many people as possible into competitive integrated work settings. So those of you who had not lost confidence in me previously, I presume now I have convinced you to do so. So that is what I have.
Thank you, Fred. So let me set the stage for the next question. As we all hear, and also the panel members have heard, that we have all these multiple TA centers, and we all know that each of these TA centers, they from our different universities or different university partners, they all have different charges. They're all different in a sense. So what are your expectations of their coordination and collaboration, each of them or all of them, to meet the VR agencies and the practitioners' needs to meet those outcomes? Steve?
Well, I think we've touched on that to some degree already, but to maybe just take another stab at some depth there. Obviously, the streamlining of efforts, I think Allison said it well. WIOA is a wonderful piece of legislation. It truly is. It provides us with a lot of opportunities. We are able to do a lot more, we believe, a lot more things than we've done in the past. At the same time, it's new. And so our directors have great demands on them attending to normal duties in addition to implementation, policy changes, practice changes as a result of WIOA. So streamlining the contacts, and I think that's a role that CSAVR, and I'll give John Conley specifically kudos for that, means a lot. So being able for the technical assistance centers to use their collaborative efforts to be clear on the messaging that they're sending, to provide products that are tangible, workable, that we can implement, and to give us the feedback that we're asking for, when we're having those kinds of dialogues, with an undercurrent, or maybe the umbrella being focusing on, and I know I've said this more than once, but focusing on how is this going to increase outcomes, putting individuals with disabilities in competitive integrated employment, increasing the workforce participation rate of people with disabilities in the workplace. So that's kind of in a nutshell, I think, John. And if I can go back to something that was mentioned yesterday by Paul Wayman, a scholar amongst us, as we know, but he talked about the focus and the role of evidence-based practices, and he brought to mind two things that we in this community, specifically researchers, need to be asking. It started with what? What is the evidence, and what is the quality of the evidence? And I know that probably in this community, in this room, that's very much the way we approach things. What's the evidence? What's the quality of evidence? I'd add just one more to that, and that is the so what. So what? So how is that impacting the practitioner in the field?
Great. Thank you. Allison?
Yeah, I think I've touched on this a little bit, but a couple of things I just want to make sure that you all understand. We've talked about how much WIOA is putting work on the state agencies, and that's going to continue for a while, but it is a good opportunity. I want to make sure everybody understands that. There's so much going on there. And at some point, either yesterday or today, I heard someone talking about all the information that this research and the evidence-based practices, I think someone mentioned a registry, and all of this information that's going to be available to the counselors. Well, I'm just going to bring you my perspective to this. I know my counselors are not spending time looking at registries or long lists on websites of, hey, what's working in that research? Something that came out of the recession was that we're going to work more with less. And for whatever reason, that notion has stuck around. So, and I know you all are familiar with that as well. So realistically, you have counselors in states with very large caseloads, higher than the directors want it to be. And I even asked my fellow director from Montana, Jim up there, I said, do your counselors have time to go and look and say, what's out there that's been researched that's going to work with my one consumer that I'm working with? And he was like, no. So realistically, when you are, writing up this research and identifying what's working best in whatever area you looked at, you need to be writing it for the leadership and management of that agency, not necessarily for the counselor, because my managers and my leadership team are the one that's going to be implementing any new initiatives. So they have to understand the value of this, and they have to put it in that policy perspective and process for the whole state, meaning all the counselors. How many here has ever been a counselor for a public VR program? Yeah. You got to remember, and I was a counselor, I always have to constantly go back to what was it like when I was a counselor, when something was brought, pushed towards me, hey, look at this, review this, read this. Our love is helping individuals, and that's what we want to spend our time with. And honestly, those counselors don't want to spend time reading something that might or might not help them in their job. If their leadership and management is telling them, this is what we're going to implement in this state, because we've read that this is working in another state, and this is how it's going to apply here, then it's going to happen. So just kind of keep that mentality in place, that your management, leadership of your state VR agencies are the keys for you all to connect with, because they're the ones that's going to see how it's going to actually apply to their staff that's doing the day-to-day work. So just keep that in mind, because I know my counselors, nothing against them, but they're going to go, I don't have time to read that and look at a website. So that's something I think that's important.
Thanks. Fred?
Yeah, I agree fully with what what Steve and Allison have just said, I would add kind of one additional piece to it that I think was implied in their comments. One additional piece is how information is disseminated. What are the strategies that really allow information to be utilized by that frontline practitioner? When I ran a VR agency, just like Allison was talking about, my counselors were busy, and maybe they should have been paying attention to what was coming out in the way of research, but they weren't. And so how do we deliver it? Maybe thinking in terms of kind of from a manufacturing example, the just-in-time concept. How do we make sure that the information I need, specifically need, that I can get to it when I need it? How do you get me to know that the answers or at least ideas are out there? How do you get me as the practitioner to believe that this isn't just something added on, but something that adds to the effectiveness of the work that I'm doing? And the last piece of that is we've got a new generation coming in, and these millennials, they are different. If you don't have it on YouTube, if it's not short and punchy, they're not gonna look at it, regardless of whether they should or shouldn't.
Thank you, Fred. So go back again to how I set up the last question. All these multiple centers, they all do their own things. So how else can they collaborate? What do you expect? How should they behave to collaborate so that you can get the just-in-time information or the type of format of information that your counselors and your practitioners need? I think because they are the ground soldiers to go deliver these services to meet the demand of the consumers and therefore make the outcomes, right? So.
Well, I'm going to reflect on, DJ, I'm going to give you kudos on a session that we just came out of earlier. DJ made a comment about the YTAC that really resonated with me, and John, I think it relates back to what you're saying, and that is that in the efforts of developing your objectives, meeting with those at the ground level so that you understand it's not just a message coming from the state directors. I was a state director for a while as well, but that we're really going to the folks in the field, the practitioners that are really experiencing the challenges as we develop then our objectives, as we mature more and more into our technical assistance centers and their deliverables. So I can't take credit for that. DJ brought that up in the YTAC conversation, and I just thought that really responds to that. May I make one statement that's a little bit unrelated, but it does go back to the perspective of our profession and how we are looking towards the future. Fred and Allison and I, all three sit on an ad hoc group, a grassroots group that we refer to as the Rehabilitation Counseling Coalition. And so I'm throwing out to a group of really engaged individuals in the field of research and technical assistance and saying to you that one area that, and I'm going back to my being beat up on the Hill for a couple of years, that we have not done a good job of in this field is evidence that supports the value added by the qualified vocational rehabilitation counselor. We've got bits and pieces of research out there. I think yesterday Paul was suggesting to those over or under 45 researchers that if you want to have an impact on the next generation of this profession, let's dig in and do our research that truly supports the value that the qualified vocational rehabilitation counselor adds to the outcomes, to the workforce participation rate of people with disabilities in our country. So that's a bit of a stump speech that all three of us are kind of pushing that agenda along, and I just thought of it a day or two ago that this is an excellent audience to throw that challenge out to and say, you know, if you've got some graduate students that are looking for some research to do, turn them loose. Because you saw what happened in this reauthorization, and we see what's happening in the ESSA, Every Student Succeeds Act, is that the ESSA, where the highly qualified teacher moniker has been dropped to qualified teacher. We can expect that same kind of approach in IDEA with our special education teachers. So sorry to get off of my stub speech, John, but I want to be sure that I got that in there to this particular audience.
Okay, Allison?
Yeah, and I can't reiterate enough what Steve's saying, though. Our rehab counselors out there, that's why we're here, is because of what they're doing. But we also have to prove on a national level the value of them. So we do need that research, most definitely. And then you'll hear me again saying, and that research needs to have a little caveat of the blind and visually impaired counselors. And then a lot of states also have the counselors who specialize in the deaf of hard of hearing. That's another caveat. So there's lots of research that needs to be done out there. So, John, back to your question about the YTACs and how they best can, not the YTACs, all the TACs, and how they best can work with the VR agencies. And I will say it's that personal connection for me. Chip talked about earlier in the WinTAC, you have that personal liaison that's assigned to your state. That individual called me. We had a very long conversation. I made that connection with, I didn't even know her until she called me. And actually, I'll be honest with you, it took me about 5 or 6 minutes to realize who I was talking to. I'll be honest with you. Not her, but that she represented one of the TA centers, because as a director, there's 7 out there. And it's trying to get them all, what does that one do? What does this one do? And I will say, being here for 2 days, I'm getting the acronyms down. So that helps. So when they call me, I'll be like, yes, I know who you are. But I will say that the liaison with the WinTAC, and actually when we were at CSAVR NCSAB meeting last month, that WinTAC liaison was there, and I got to put the face with the name, so I have that connection, which is helpful. But I can't say that any of the other TA centers have that approach. While I know most of those, or I've met you here, we don't have that one person that you feel like is assigned to your state. Does that make sense? And we like having that one person you can call when you need that quick answer, you need the quick guidance. Yes, I could go to your websites, I could peruse it and go, oh look, there's a contact number, I'll just call. And then that might go to another one, it might go to another one, I might eventually find out who could give me the assistance. So I will give kudos to WinTAC in their approach and that personal liaison, and encourage the other ones to think about that as well.
Thanks. Fred?
Yeah, this is so tricky because one of the big challenges is making sure that the end user understands that there is information that is valuable. Now, when I ran the blind agency in New Mexico, this was back in the days of the RCEPs. And the RCEP in our region was a great resource, and it was a great resource because the guy who ran it, Leon Thornton, befriended us all, meaning all of us, meaning the state directors in the region. So we had a relationship, and he knew what we were up against, and he was, in effect, our portal to the training and the information that might be available to help address our needs. So I think that is one piece of it. Again, I just making sure that those relationships are there with the people that you hope will take advantage of the information and the technical assistance that you're able to offer.
Thanks, Fred. Let me set this up for the next, probably the last question. All these tech centers, okay, they all has two acronyms ahead of this, VR, the vocational rehabilitation. As we all know, vocational imply employment, right? And also part of the expectation of WIOA is to increase the participation rate in the employment setting, right? So what else can these tech centers do to focus on that piece? Because ultimately, like Paul said yesterday, and also what you said a little bit earlier, Steve, the outcome ultimately is the employment outcome that the federal government's looking for, right? So let's pay attention, let's talk about that piece from your expectation of these tech centers in terms of their collaboration to get there for VR agencies and most importantly, for the counselors.
You know, I have to wear my director hat, and with all the great evidence coming out there, and I know there's a lot, I have to prioritize it to what is going to give me the biggest bang for my buck, honestly. With limited dollars, limited staff, I have to look at what approach can we implement that's going to give me the greatest outcomes, and sticking with that competitive integrated model. You know, there's some great things out there, but I know it might only benefit 1 or 2 of my consumers, to be honest with you, or 5. I'm looking for that, how many folks can I help as a whole? And when you have to prioritize what you're doing, you're going to want to approach it that way. So when you're doing your research and you're producing that documents for us, keep in mind, is this helping 1 or 2 individuals, or is this truly making an impact on the disability population as a whole? And that's what we're going to look for, is what can we implement that's going to have the biggest impact.
Steve or Fred?
Sure, and basically repeating, I think, what Allison said, with maybe just a little bit different twist, and that is beginning with the bottom line, with the outcome in mind, and you know, we're rightfully so. There's a great deal of research, surveying, assessment, evaluation, information gathering that has to take place in order for us to really turn that into a deliverable for the state agencies. And I don't think anybody suggests that we shouldn't do that, because we need that quality of input to be able to deliver a quality service to our state agencies. I think my caution there would be, and this is from a non-researcher, from you know, just being in the field, I think the danger is that getting so steeped in the process itself, though, that it really does distract from even a well-intended outcome. And so just tempering that with an appreciation that the sooner that a state agency has a deliverable, the quicker they'll be able to put that into play, and the quicker we'll be able to put people to work. And so, you know, John, maybe again going back to the thought that we have long-term objectives in research, without a doubt, but if we can find ways, and this sounds terrible, and I hope that nobody's going to attribute this to my coming from me, but in some cases it's a matter of kind of picking that low-hanging fruit and throwing out there what we know we've picked up on as being an effective practice, and getting that disseminated to the field. And then as we develop more evidence and more practical application for the midterm and long term, that's helpful too. So give us some meat as quickly as you possibly can, and then continue our research to build that evidence to be able then to impact long-term change. We are really in the midst of a huge change in our profession. I think we all can agree to that with this opportunity in WIOA. So it's a generational shift in my view. It's one that really is going to push us towards the future in a new and different way than the 35, 36 years that I've been in the profession.
Thanks. Fred?
Yeah, Steve, I just tweeted out what you said, so it's out there in I wouldn't know.
I'm getting tweets back, if that tells you anything. Yeah. I don't know what a tweet is.
I was going to say, so. I always thought a tweet was something that Barbara Walters gave her dog, but anyway. Okay, so WIOA, I figure I'm about to leave so I can kind of be as... So we owe the devil is always in the details. And what happens is, very often we think we have in our minds what we're asking others around us to do. But what we're saying doesn't convey what we think it's saying. So where am I going with this? So WIOA has this emphasis on integrated competitive employment. And it also has an emphasis then on, I mean, who is in danger of not having integrated competitive employment? Well, it's people with very significant disabilities, particularly youth with disabilities, and hence Section 511. So at the same time, if you say to the agencies, we want you to get the numbers up, how does that square with saying, we want you to take kids who are have very, very complex disabilities, and we want you to seriously work with them for a period of time, recognizing that they may or may not be able to attain integrated competitive employment. Those are at odds. And so what happens is we have two choices. I mean, we serve the people we serve today, and we get the outcomes we get today. And so the Congress says, get those outcomes up. We've got two choices. We can look at the hard-to-serve population and say, what can we do to be more successful with the populations that have been difficult for us to be successful with in the past? Or we can say, how can we go out and find people who have really very minimal needs, who can be served quickly and cheaply and placed into a job? Those are, and my point is really, again, well, all right, so we set up the standards and indicators. We regulated on that. And what we tried to do with the standards and indicators is create a mosaic, a collection of indicators that any one of which was not fully representative of quality employment, but taken together would be. And in some ways, we did a pretty fair job. All right, so my wife is totally blind. She's a senior computer programmer, has been for many, many years. She's extremely talented, and she's one of the most highly compensated programmers in the business where she works. The state where we live, she has never been a VR client. Many years ago, not the director who's there now, the agency did not pass the wage indicator on the standards and indicators. So the word went out to the counselors, get the wages up. So suddenly, and my wife still doesn't know how they ever found her, the local counselor called her up and said, oh, I've been wanting to drop by and meet you. Can I stop by and we'll have a cup of coffee? And my wife's a pleasant person. She said, oh, sure, stop by, we'll have coffee. The counselor came by and said, hey, could you use a new Braille display? Oh, yeah, she said. So suddenly we've got a job retention case, a person with a significant disability, and the wage is very good. My point again is to say that as we look at really any objective that we have, part of what we need to look at is how to help inculcate the value. I still think wages is an important indicator. But what I want is it to be a value. I want my counselors, where I'm still running an agency, to value getting people into jobs that could really sustain them, not simply comply.
Thank you, Fred. We're near the end. I just want to make a quick comment. I think personally and professionally, I think it's about time that these tech centers work together, because for a long time, we work in silos. I think it's really wrong to do that. I think it's great that we start to begin this collaboration. The tech consortium to do this joint needs assessment is probably a very first step. And I can also tell you that right after this meeting, we have a 3-hour, what is it called? Technical Assistance Center collaborative meeting, another TAC, for another 3 hours to basically lay out some more of the collaborative issues that we need, all these tech centers need to work on. So I want all the tech centers to take heart and also listen to the comments from our presenters and panel members, and we'll continue to work on that collaboration. So let's give the panel members a big hand. At this point, let me ask Team Tansy here to do some closing remarks.
You don't have to leave, Steve. No, I'm just teasing. Go where you're going. Again, I can't thank Steve, Allison, and Fred enough for coming today, spending the time, and sharing kind of their insights. It's again, this information I think is highly needed by both the centers involved, as well as I think, again, talking with our partners at RSA, Neidler, kind of where we need to head as a group and kind of the things that we need to look forward to. I hope that this was a great event for everyone. I know I got a lot of benefit out of it. I know I'm probably behind on work as a function of it too, but it was well worth the time spent. I think as we move forward and continue to look at what we try to do as far as providing state vocational rehabilitation agencies the information, the tools, the support they need in doing their work, I do believe that this collaborative effort that we've started across all the technical assistance centers will be, I think, a model example both within, I think, the Rehabilitation Services Administration as well as across other federal agencies. Last couple of housekeeping issues that I'll get yelled at by Priscilla, who's really my boss, if I don't bring them up. If you haven't filled out an evaluation, we'd love to hear your thoughts on this event. Really, those evaluation forms are critical in us thinking about, is this a worthwhile activity? Should we host something like this again? What type of additional information or input do we need to have in that meeting? And then ultimately, the composition. Do we have, I truly enjoyed the speakers and the people we had here today. Is there other information that we need to provide in those types of sessions? So I highly implore you, if you can, please turn in those evaluation forms. And is Priscilla in the room? Yeah, there's Priscilla. So there's Priscilla. If she sees you leaving without turning in your form and she knows who you are, she will track you down. I'm just, we have your home address. We're not afraid to use it. No, we will not violate any federal or state stalking law statutes. But thank you all for coming. We really appreciate your attendance and hope to see you again at this event in the future. Thank you so much.